Hey, hey, and welcome to Film Surgery, where we dissect deep into the amazing world of cinema. I'm your host, Nick Wright.
And I'm your other host, Sanjay Arman Kumar, a neuroscience major at the University of Oregon.
Welcome to the show, everyone. So, Sanjay, we're back. It's 2025.
Yeah, man. Happy New Year. This is our first episode of the year. How's it going?
Yeah, it's pretty good. It's pretty good. I had a good break. I had a good break, and I'm happy to be back at school.
That's awesome, man. Yeah, me too. It's so fun to, finally be back at school and recording more episodes of Film Surgery.
Yeah, for sure. So for this episode, where we'll be talking about awakenings, I kind of didn't know what to think about it at first. It was kind of emotional for me, having worked in a senior living facility. But I don't know. What did you think about it?
Yeah, I totally agree, man. I mean, I thought the movie was very well made. The acting was incredible, especially as someone who's comes from a family with a medical background and who's currently a neuroscience major, hoping to get into medical school. It definitely resonates, close to home, and it's pretty inspirational, especially with Dr. Malcolm Sawyer, who's Robin Williams' character in the movie.
Yeah. I mean, Robin Williams is he's well known for doing great characters.
Yeah, he does a mix of so many different characters. Of course, known for his very rapid and energetic, comedy, all his comedy movies. But then he also has this other side where he kind of acts as this neurologist, and he has this darker roles, kind of on a, which is a contrast from what he's usually known for.
Definitely. Sadly, he is not here anymore. He died August 11th, 2014. But definitely, one of my favorites was Jumanji, Night at the Museum. Those are some definitely famous movies. Got that good sense of humor,
Oh yeah, definitely. Rest in peace to this comedic legend. He also was one of my favorite roles of his was in Good Will Hunting.
Oh, I love Good Will Hunting.
It's such an awesome movie with starring Matt Damon, and Robin Williams plays his psychologist.
Yeah. But okay, can we talk about Robert De Niro? He knows how to play a character, and I'm just I kind of can't believe how good he did.
Yeah, he did a phenomenal job in this film, acting as this patient in the mental hospital, and knowing his history in acting, it's really different than what he usually does.
It's crazy when he was given that medicine that Robin Williams was trying to kind of figure out what the cure was. He was cured for, was it a couple days? Yeah, he was cured for a couple days, and his switch from being this patient who couldn't do anything to this basically normal person.
Yeah, exactly. Yeah, and just for context, the medication that Robin Williams is kind of doing a lot of research on and trying to use on Robert De Niro is called L-Dopa, which stands for levodopa, and it works on the. It actually was used for a long time as kind of a treatment for the Parkinson's disease, and well, L-Dopa, which is levodopa, refers to dopamine, which is this excitatory neurotransmitter in the brain, which is really involved with enhancing your functions, like your memory and even any kind of feelings when you're of pleasure, feeling good, and even muscle movement, which is how people act really hyper if they have high dopamine. But then Parkinson's is caused if you have low dopamine levels in the brain. And I think Robert De Niro did a fantastic job kind of exhibiting the symptoms of the condition that he has, as well as the side effects when he's having the medication.
Does he actually have Parkinson's?
The actor, Robert De Niro?
Mm-hmm.
No, he doesn't.
No, okay. That's what I thought. So that's incredible how he's able to bring that to life.
Exactly. It's so convincing. in the role.
No, for real. I was shocked.
Yeah, there's a one scene which is really brief in the film when he's like brushing his teeth, and he's getting like he has the toothbrush with the toothpaste, and he gets closer and closer to his mouth, and you can see that he starts tremoring as he gets close, which is again kind of exhibiting those symptoms that he has.
Would you say that's a more common symptom for Parkinson's?
Definitely tremors, yeah, tremors of, any kind of, because it affects low dopamine levels for your muscle movement. So that's definitely one of the symptoms as well. And even you can recognize that people who deal with this disease have trouble walking. So they have maybe,
Oh, they do?
yeah, like limited walking.
So they like get walkers or wheelchairs?
Yeah,
Or
they usually would need
because they
assistance.
can't.
Um,
Okay.
this is a famous example would be Michael J. Fox, who acted
Yeah.
in the Back to the Future trilogy. And now, sadly, he deals with Parkinson's disease. So if you watch any kind of modern interviews of him, you can see that he has some trouble with his when he's speaking and even trying to control his head movements.
And actually, I saw him on getting the Medal of I can't remember what award, Medal of Freedom or Valor. I can't remember, but he got it from Joe Biden.
Yes.
And he needed two people on either side of him to help hold him up. And I was curious why that was, because like when he was acting, it didn't seem like he needed anything. But I guess it affects you more strongly when you're older.
Yeah. Yeah, exactly.
Yeah. Well, actually, I noticed something I forgot to say was the description of the film, which might help people understand why we're talking about this. The story of a doctor's extraordinary work in the 60s with a group of catatonic patients he finds languishing in a Bronx hospital, speculating that their rigidity may be akin to an extreme form of Parkinsonism. He seeks permission from his skeptical superiors to treat them with L-Dopa, a drug that was used to treat Parkinson's disease at that time. So that really gives you an idea of what they were like having to do. Catatonic patients, like they can't move anything.
Yeah, exactly. With that's a common symptom when they may raise their arm, any kind of muscle movement, they're not really aware that they're doing it.
There's that scene actually in the movie where they're trying to figure out what disease they have, and Robin Williams throws that ball and the woman catches it out of the wheelchair. She hasn't moved in several years, and she just like raises her hand.
Yeah, exactly.
And I was like,
yeah,
she's a superhero.
That's so crazy because they look like they're kind of distance from reality, right? That the patient in the scene, but then they recognize this ball coming towards them and just catches it in the moment. And the part in the description when it mentions Parkinsonism, because for a while we were just now talking about what Parkinson's disease is, but the difference is that Robert De Niro doesn't actually have Parkinson's in the film. The actual condition he suffers from is called encephalitis lethargica, which is a neurological condition caused by severe inflammation of the brain. But in the description, it says Parkinsonism, meaning that it reflects similar symptoms of Parkinson's, but he isn't actually diagnosed with it.
Got it. Okay. I feel like that's kind of an important distinction, because if you're giving them something to treat Parkinson's and it's not actually that, then could it hurt them?
Well, he exhibits similar symptoms, such as the low dopamine levels. So you can see how he has tremors and even like abnormal like eye movements and as his character. So this really explains how Dr. Sawyer in the film is researching how this drug can help treat his condition, and it kind of does take place in, is it the 1960s when this movie takes place?
Yeah, it's in the 60s.
Yeah. And this, I believe this is when the drug was first developed.
Yeah, I think that's what they were talking about. But you can see it in the beginning of the movie. When he's a kid, he started getting those like tremors, and everybody thought it was just him. Like I don't think they knew that he had this disease.
Yeah, exactly. Because maybe many people didn't really were diagnosed at that time. So it's kind of a rare case for him. I want to talk about one of my favorite scenes in the movie.
Please, yeah.
Which is when Dr. Sawyer takes Robert De Niro's character out for like ice cream or something like that, and they just kind of have this like bonding experience out of the mental hospital. It shows how his patient, he's secluded from society. He's always in this mental hospital, but now you can see how he's kind of adjusting to the community around him outside of the hospital, which I thought was a beautiful moment.
Awards. Let's talk about that. Because this movie, it's gotten a couple nominations and 2 awards. It's gotten a nomination for Academy Award for Best Actor in a Leading Role. And it's won the National Board of Review Award for Best Actor and the New York Film Critics Circle Award for Best Actor. So it is, it's
Yeah.
very,
Really, yeah, it's worth it,
so
man.
worth it.
With Robin Williams and Robert De Niro, their just acting has to be acknowledged that way, and that's amazing.
I was wrong. It's gotten the Academy Award for Best Actor in a Leading Role, Golden Globe for Award for Best Actor. These are the nominations. Academy Award for Best Picture, Academy Award for Best Writing for an Adapted Screenplay, Writers Guild of America Award for Best Adaptation, National Society of Film Critics Award for Best Picture, and Japan Academy Prize for Outstanding Foreign Film. That's insane to get nominated in Japan.
That's crazy. In Japan.
That's
That really
so
shows
funny.
how impactful that is. And in Japan, it got the award. So it got tons of awards.
Those are the
just
nominations,
for
sadly.
Best Picture.
Yeah,
the nominations.
they've only won 2 of them, but still very good. Anything else before we wrap this up? Anything else you want to talk about, Sanjay?
Well, yeah, I just thought this movie was, I have to say, it's probably one of my favorite psychological / medical films I've seen. It's very, very motivational, I'd say. As when looking at the neurologist, Dr. Sawyer, that Robin Williams plays, and especially someone who's right now focused on the brain, a neuroscience major. This is a movie that I really love to think about, especially as I move on with my career to go into medicine eventually, and even to a good way to bond with my dad, who's also a doctor of medicine right now, and this is a movie that we both love. So
Dr. Sanjay Arman Kumar Sr.
Yeah, that'll be me.
Well,
Man.
is that you?
That could be eventually in the future.
Awesome.
We'll both go as we're doing film surgery.
Yeah, definitely.
Yeah.
Well, Sanjay, this has been an awesome episode. Thank you for talking with me about Awakenings by Penny Marshall.
Of course, man. Of course, this was really fun. This was a great episode, and especially a great way to, celebrate the 2025.
Yeah, definitely.
Yeah, awesome. Thank you all for listening, and please stay tuned for our next appointment.
Thank you.